Miss Mimosa?
Mhm.
Good morning. Pleasure to meet you. I'm Fafa, and I'll be your physical therapist today. So, what we're going to do today is the initial evaluation, and which should take about an hour or so. And so, for the first 15 minutes, I'm just going to be asking you questions just to kind of get to know you a little bit better and everything that's going on. And then we'll move from there to the physical examination. Do you have any questions?
No,
No? Awesome. Thank you so much for your time. Let's get started. So, just to verify, would you mind telling me your age and your date of birth?
I'm 29, born September 28th, 1978.
Awesome. And have you been to physical therapy before?
No, but I did go to OT for my hand.
Mm.
It wasn't a good experience.
Oh, I'm very sorry about that. I'm sorry you didn't have a good experience, but if at any point you have any questions about PT or anything that might come up that you may be concerned about, feel free to let me know and I'll do whatever I can to remedy that situation for you. Okay, Miss Melissa, tell me a little bit about what you do for work.
I'm a telemarketer.
Okay. And what does that consist of?
I sit at a desk and answer phones all day.
Okay. And how many hours how many hours a week do you work?
I'm full-time, so 40.
Okay. Awesome. By the way, I'm going to be writing down stuff on my paper here just so I don't forget anything. And outside of work, do you engage in any hobbies or exercise?
Yeah, I actually do. I'm really big into MMA. I really like the style of Krav Maga, and so I've been doing that for a couple of years, and really good.
Very cool. Outside of Krav Maga, are there any other hobbies that you engage in?
Not really. I mean, I just go home, watch TV, Vampire Diaries.
Oh, I've heard a lot of good things about that show. I feel like it's time that I finally watch an episode.
Yeah, I would highly suggest hopping on the bandwagon.
Yeah, I definitely will. Okay, Miss Melissa, tell me a little bit about what a normal day in your life looks like for you from morning until when you go to sleep at night.
So I wake up, and depending on how the day was previous, I'll go to the gym in the morning. But sometimes I don't do that. Most of the time, I'll just go to work, and then I'll go to the gym in the evenings. I normally go to the gym every evening, just to work on that aggression, because customers are just so annoying when you're in telemarketing.
Yeah, I could definitely understand that. But it's good that you have a good stress reliever to get all your stress out. That's good. Awesome. Okay, let's talk a little bit about what brought you in today. I understand that you were referred for a right hamstring strain. Is that correct?
Yes.
Okay, would you mind telling me where that pain is located?
Yeah, it's gonna be right here.
Okay. Is there any pain in the back of your knee at all?
No,
No. What about down your leg?
no,
No. Anything in the front of your leg?
no,
What about your hip? Any pain in your hip?
no,
What about the other leg?
no.
Okay. Anything in your upper body, in your arms, hand, stomach area, anywhere?
No, I mean, my hand hurts me every once in a while, but that's really just because that OT did not know what he was doing.
Mm. And is your hand something that you'd like to get addressed in therapy?
No, I don't want anyone to touch my hand.
Okay. Awesome. Would you mind describing what your right hamstring feels like? Is it achy? Is it dull?
It is achy and very sore,
Mm.
kind of sensitive. It feels like when you go to the gym and you work out and you're sore, and that lasts for a couple days, maybe 2 max.
Mm.
And well, this is like way worse soreness,
Mm.
and on top of that, it just won't go away.
Mm. I see. Okay. And are you experiencing any numbness or tingling in that area, in that right hamstring?
No.
No? Okay. Alrighty. So on a scale of from 0 to 10, 0 being no pain at all and 10 being the worst pain ever, how would you rate your pain right now?
Probably a 6.
6? Okay. And when it's at its best, how would you rate it?
Probably only a 4.
What about when it's at its worst?
12.
12? Okay. So does this kind of look at like where your pain is?
Yeah.
Yeah. Okay. So tell me a little bit about your home environment.
I live in an apartment. I live alone. I don't really like people.
Mm. Do you live on the first floor or second floor?
I live on the second floor.
Okay, so you have to go upstairs to get to your place.
Yeah, unfortunately, I don't live in one of those ritzy apartments where they have an elevator.
Yeah, understand. Are you using any crutches or canes or anything to help you get around?
No.
Okay, so tell me a little bit about what activities kind of make that pain worse for you.
Um, Walking, doing the stairs at my apartment, um, and definitely my Krav.
Mm. So how long into walking before you start to feel this pain come on?
Probably about 2 minutes.
Okay. What about the stairs?
I don't really know the time, but it's probably about like halfway
Mm.
when I'm up the flight of stairs to my apartment.
Mm.
That's when I'm like, okay, take a little rest.
Mm.
Do the other half.
I see. And what about Krav? How long into Krav before?
Instant.
Okay.
I can't do anything with lower body in Krav, which
Mm.
is super frustrating.
Okay, and so what kind of things do you do to make your pain feel better?
Um, let's see. The doctor told me to do rice, which rest and ice. I don't remember the other two, so I haven't been doing those. But I did. But I do rest and ice it, and then the doctor also gave me pain medicine, Mobic.
I see. Okay. And how long into resting and icing before you start to feel relief from that pain?
Probably about 10 to 15 minutes.
Okay. What about with Mobic? How long before you start to feel relief?
I think it takes about 30 minutes before the pill to kick in.
Okay. Awesome. So in the mornings when you wake up, how does your pain feel? Does it feel any better, any worse?
It normally feels the best that it's going to feel.
Mm. Okay. And what about throughout the day? How does it feel?
It gradually gets worse throughout the day.
Mm. And what about at night after you're done with your day's activities?
It's probably the worst,
Mm.
and that really affects me because I go and normally do Krav at night, and it hurts to even stand almost.
Mm. Alrighty, so I went ahead and took a look at your intake form, and I wanted to ask you a couple questions just to verify some of the things that you put on there. So I see that you consume about 5 drinks per week. Is that with your Vampire Diaries, like you mentioned, like about 1 glass a night?
Yeah, about one
Okay.
glass of wine a night.
Okay. I see. And I see that you had prior surgery. What was that for?
Um, that was for my hand. That was what was it called? OF something.
Mm-hmm. Okay. And any other surgeries besides your hand?
No.
Okay. And I see that you put bipolar disorder here. How are you and your doctor managing that?
My benzos and lithobed.
Okay. And you put here that you have difficulty sleeping because of your pain. So would you say that the pain causes you to wake up out of your sleep at night?
Not the pain. Yes, but it's more of like when I roll over, like that movement triggers the pain.
Mm.
And so then I have to like stop and be still,
Mm-hmm.
fall back asleep.
I see. Okay. And do you have a family history of any conditions, high blood pressure, cancer, anything like that? No? Have you had any x-rays or MRIs done?
I did have an X-ray in the ER.
Mm-hmm. When was that?
It was a week ago.
Okay. Did they tell you any results?
They said I didn't have a fracture,
Mm-hmm.
but I don't even know why they did an X-ray in the beginning because it was so obvious that it was my hamstring.
Mm, see. Okay. And I see here that you put you learn best by doing. So I'll definitely make sure that while you're here in the clinic, you'll be getting repetitions of and a lot of practice of all the exercises and things that you'll be doing here so that when you go home, you'll be able to do them. And I'll also give you a handout with everything that you're going to do so that you'll be able to know exactly what you need to do. And I see here that you're taking Mobic, Lithobid, and benzos. Are there any other medications you're taking besides these?
No.
No? Okay. How often are you taking these?
The Mobic I take 3 times a day. And then the Lithobed and benzos I just kind of take as I need them.
Mm-hmm.
More the benzos than the Lithobed.
Mm-hmm. Okay. And do you feel like these are working well for you?
I guess we'll assume that my doctor knows what he's doing, although there is belief that he does not.
Mm. Awesome. And besides rice and medications, is there any other treatment you're doing for that hamstring strain?
No.
No? Okay. Alrighty, Miss Mosa, go ahead and tell me a little bit about how this hamstring strain came about.
Well, like I said a week ago, I was at my sister-in-law's, and she has this son, my nephew, who is really annoying and was egging me on, saying that I really don't know how to do Krav Maga, that I'm full of it. Well, I took him outside, and I was going to teach him a lesson, you know. So I go to kick him, and as soon as I bring my leg up, I just immediately crumpled down in pain. It just felt so terrible. It was like a sharp burning pain, you know. Definitely felt like I pulled my hamstring. So I just don't know why the doctor didn't go straight and do an MRI. Instead, he decided to do an X. They decided to do an X-ray at the ER. And then when I asked him about getting the MRI, he said that I had to do PT first.
Mm.
If I was going to get the MRI.
Mm-hmm. I see. Well, an MRI is not always necessary for hamstring strains, but I can assure you that we've definitely seen cases very similar to yours. So I think you can definitely trust that we'll be able to get you back to all the things that you love to do. So definitely we're going to do our best to take care of you here. Awesome. So, and have you had this hamstring strain before?
No.
Or any pain in that right back of your leg before?
No.
No? Okay. Alrighty. And I noticed that you kind of seem a little bit anxious or upset. Are there any fears that you have toward therapy that you didn't already bring up or anything that I can address for you?
I honestly don't know why I'm here. I did OT before and it didn't help. So no offense to you, but I really don't think this is going to help. I really think I need an MRI to see really what's going on.
Mm-hmm. Yeah, I definitely understand that. And we're going to do, I'm sorry that you had that experience with the OT, but we're going to do everything in our power to make sure that you can get back to everything that you need to do and the things that you love to do, like your Krav. So, and if at any point you have any questions or concerns or anything else, feel free to let me know and I'll explain to you or try to remedy anything that's going on for you. So yeah, definitely feel free to let me know. Are there any other specific goals that you want to get out of therapy?
I just want to get back to my Krav.
Mm-hmm.
You know, that's like my main life source.
Mm-hmm. Yeah. Well, we're going to do everything in our power to make sure you can get back to that Krav because I definitely can understand how it feels like to have something that really helps you and like just have it taken away. So we're going to do everything we can to help you get back to that. Any other goals that you have?
I don't think that's it.
No? Okay. Any other questions before we move on?
No.
No. Alrighty, then let's move on to the physical exam then.
Okay.